Hello everyone, this is a demo video of Care Program Management. Now before digging into the actual functionality of the application, let us first get a quick idea about Principal Care Management and Chronic Care Management. Now what is Principal Care Management? Principal Care Management is a model for the care of patient with a single chronic illness for a period of lasting 3 or more months. The patient must also have had either a recent hospitalization or an acute risk of death, or a functional decline, or require management that's unusually complex due to comorbidities. Coming on to the chronic care management. Now, chronic care management is considered as a critically primary care service that contributes to better patient health and care for patients with multiple chronic conditions. Now, currently, the need for the market is that a lot of revenue is lost on the smaller tasks that can be tracked under PCM and CCM. Now, existing electronic health records are not sufficient for tracking these tasks. Our application helps to make the process efficient and capture the lost revenue. So, let us begin with the functionality of Care Program Management. Now, to utilize the functionality of the application, we have a sample Principal Care Management care program set up already, as you can see here on the screen. So let us see how to enroll patient in it. As we see on our right hand side, we have a patient enrollment card, or you can say a form. So let's begin by enrolling a patient. Let's take the name as James Lee and consider the starting date as 2nd April, and enrollment date can be, it is optional, but we can also go for, let's make it April. Yes. Now after selecting the product, we click on to next. On the next screen, select the care program provider for the product, and if available, choose from the existing account teams for the care program or select new members along with their roles in the additional team member. So as we can see, we have existing account team, we have additional members as well. So let's go ahead and click a team member into it, and let's choose the role to be registered nurse only. We can add multiple team members, but for time being, we are adding one here. Let's click on next. And on the final screen, we have to select the user who received patient consent and the date of consent along with the care plan of the associated patient, and click save. So here we can choose the user to be Vedansh, and date of consent, we can choose 2nd April or 3rd, whatever the date of consent is. After that, we can choose a care plan, and let's click on enroll. This process enrolls the patient into care program right from the care program record page, and also it provides an easy tracking of PCM billable time for providers. Now let us move on to details section and go to billing dashboard. Now you need to click refresh on the billing dashboard to see the new opportunities populate for the patient. As we can see here, it is James Lee, May 24, and yes. Now these opportunities get created for active enrollments monthly and are used to keep track of billing. Also along with that, you can use filters. As we can see here, we have patient filters on which we can just write the patient name and it will get filtered out. We can filter it by month, April, May, June, anything. We can filter it by that. We can filter it by year, and also by the stage of the opportunity, whether it is eligible for billing, not eligible for billing, charge slip, audit, whichever way we want. And if we have multiple records, then we can also choose the number of records which we want to see at a time. Now along with that, we can see here that our new patient shows physician and non-physician time as 0 minutes each. So for that, we can add the time to this record by creating a new task. Let's click on the green new task button in the activity card, as you can see here. And for testing purposes, we will create a dummy task, and let us choose our care program enrollee, and let the subject be clinical review. We can assign it to Vedansh, and For testing purpose, let's keep our status as completed, and priority can be as per the requirement. We are taking it normal here. Let's choose the due date. It can be 2nd May. Duration. So here we have to keep a note in mind that the application adds up the time for patients' monthly tasks like a roll-up summary field. And it is only for the demo purposes that we are making it a point that the time is higher than the threshold value that we set for non-physician and physician while creating care program record, so that the opportunity becomes eligible for billing. So let us give it a value of 40, let's say. And comment can be James, let's say physician time log for reference, and hit save. Now once we do that and once we refresh our page, we can see that it is reflected back here. In the opportunity section for James D, we have in the physician 40 minutes of time log. Now let us also fill the non-physician field. For that we'll again go to the new task under the activity card. Let us choose our enrollee subject. Let us choose something different, coordinate with POA. And here we can assign it to, let's say, Jennifer, who is a non-physician. Status can again be completed. Priority, let us keep it high this time. Due date, keep it 3 or 2, let's say. And comment can be James non-physician time log. Let's put a hyphen there. Duration here can be, let's say, 20 minutes. And hit save. And let's click on refresh. And here it gets populated. So along with that, we can see that we have various other functionality also present here. We have patient filters. So supposingly, let's say as this is set on a particular month, if the filter is for all and we have to select one patient, so we can type it and the patient will get filtered out. Now we can choose it for different months, Jan, Feb, and as we are starting from April, so we have records in April and May. And let's remove the filter. Then we can filter it by year as well. We have stage. We can filter it by whether it is eligible for billing, eligible, not eligible for billing, charge slip, and so on and so forth. If the records are high, we can click on the per page section and how many records you want to see on this per page, and you can see move forward by these two buttons as well. So moving forward, we can also use the eligible for billing button to send a bill to the customer for the task performed for them in the current month. This was all for the care management program. Thank you for joining.